Flowers are blooming and the grass is growing quickly, but if you're one of the millions of people who have seasonal allergies, you're also dealing with sneezing, congestion, and other symptoms. Joining us now with how to address those symptoms is Dr. Gailushas from Mercy's Ear, Nose, and Throat Clinic. Doctor, thanks for joining us here today.
Of course, happy to be here.
Well, some years are better than others for allergy sufferers. What are you seeing with your patients for this year in terms of allergy symptoms?
That's a really great question. Actually, we're seeing a bit of an increase this year. I think a lot of it has to do, we're getting a lot of rain, which is good. We like that in the spring, and it's great for the farms and for the trees and the flowers, but of course it produces a lot of pollen in the process, so we do run into that, of course.
It looks nice, but it's a problem for some.
Of course.
And for some people, is this a seasonal issue that they are just destined to face every single year?
You know, it's a great question. In terms of allergies, it is something that people who do suffer from them will have for a majority of their life, but thankfully there's good treatments out there to help and reduce the burden. Of course, avoiding allergens is a good first step. So if you know that you suffer from trees, for example, which is our spring allergen, limiting your exposure can make a difference, of course.
And is there some point when you need to go get medical attention?
Yeah, obviously, if you find yourself it really affecting your daily living, more than just, oh, I have a few days of sniffles or sneezes, but you're really dealing with lingering symptoms. Maybe you're having issues with sinus infections or trouble breathing at night.
Scary.
Yeah, exactly. Then you definitely want to be seen. There's wonderful medications that can be considered, some over the counter, some prescription, but it's important to get a good assessment to determine, what is the nature of this, where is it coming from, is it limited to just allergies?
Yeah, and is there more treatments than just over-the-counter medications?
Yeah, there are. There are several prescription medications that can be considered. There's also allergy therapy, which is designed to help desensitize people to the allergens that they suffer from. But also sometimes if people have had allergies for a very long time, they can develop more of what we call a chronic sinus condition, where the sinuses are more in a state of perpetual inflammation, and that does need to be treated a different way.
Something you'd really want to take care of.
Absolutely, absolutely.
All right, Dr. Gailushas, thanks for joining us here today.
Of course, happy to help. Thank you.
And stay with TV9. We'll be right back.